it's Kristen from North Shore Corrective Health, and welcome to today's exercise video. Today I'll be going over pelvic tilts. So when I explain that to patients what a pelvic tilt is, I call that neutral spine. So your core and your back are working together as one. Or if you see people with poor posture or lower back pain, they like to go like sit forward a little bit, or they like to arch their back. If you actually can use your core and your back at the same time, you'll actually have less pain, better form of things, and overall better lifestyle. So doing a pelvic tilt is super basic and easy. Once you have that concept down, you can incorporate that into all of the exercises. And after a while, you'll be doing a pelvic tilt and not even realizing, like sitting at your desk, standing, being at school, being at work. So you're not doing like the hunched over position that people like to do a lot. So pelvic tilts either can be performed in your bed, on the floor, if you're able to get up and off, depending on if you're in pain or not. Again, I recommend if you are having any pain or discomfort with the exercises, please stop. If you're feeling more sore, like, ooh, I'm like working out now because something different, that's fine. But always, again, consult your physician or Dr. Joe or Dr. J to make sure you're on the right path and that you're ready to do those. Okay, so pelvic tilts. You're gonna be on your back, and then what's gonna happen is you're gonna keep your legs up in this position. So if you can, feet are going to be nice and flat. You can have shoes on, shoes off, socks on, doesn't matter. And as long as you have something comfortable to wear. People who come in sometimes do wear jeans in the beginning of exercises, that's okay. As you progress, I do recommend having like workout clothes on like I have. So pelvic tilt. I'm going to exaggerate a little bit. So people think a pelvic tilt is when you try to get your back nice and flat. And ideally that's what it is. So I'm arching my back on purpose. You kind of can see my hand through here. This would be wrong. I'm actually putting more pressure on my back than I actually should be. So what I'm going to be doing is I'm going to be bringing my back flat, like my belly button to the floor, like how like the belly buttons might want to talk. Then you're going to bring it in. So as I breathe out, you should be able to see my hips kind of rotate back. I should feel a good contraction in the side of my abs, like a 2-3 second hold, and then I'm going to relax. When I relax, I don't have to go in that extra arch position. It's just meaning of relax, because your back naturally has that curve. So as long as you just take a deep breath in and then out, get that back nice and flat, hold 2-3 seconds, and then you relax. You can be sore just from doing that little bit of motion, and then that's fine. But once you get the basic concept of that, there is more progressions that we're also going to be explaining on later videos. So if you have any questions or concerns, let us know. 847-362-4476. Thank you so much. Have a great day.